So quick agenda, we're just doing our introduction and announcements right now. So today our seminar is the Places You'll Go with Implementation Science outside of academia. And today our panelists are Amy Green, who is the head of research Hope Lab, and Sarah Link, who is the senior director of clinical and translational research at Omada Health. And Cassidy is not able to join us as a panelist today. And then our moderator is Dr. Greg Ahrens.
Thanks, Anna. So yeah, unfortunately, Cassidy is actually in Europe and had something come up that won't allow her to join us today. But I promised her that we would be recruiting her for something in the future. And yeah, another person that we invited, but who couldn't make it, was Ann Rosich, who is at Hologic, which is a women's pharma company, and she's involved in global health and implementation science there. But so we're going to continue this on, but it's really my great pleasure to have Dr. Amy Green and Dr. Sarah Linke here, both former UCSD people, which is awesome. And yeah, Amy is, as Anna mentioned, a clinical psychologist with a strong commitment to research on youth mental health and well-being, and especially with minoritized communities, LGBTQ plus youth. Was upon leaving UCSD, Amy went to the Trevor Project, the vice president for research there, before moving over to Hope Lab. And yeah, Amy has just done wonderful work in really kind of bringing implementation science to have impact in the community. So thank you, and wonderful to have you here, Amy. And then Dr. Linke is a Senior Director of Clinical Translational Research at Omada Health. So what's in common here? Clinical psychologists, but for Sarah, specializing in behavioral medicine with a master's in public health as well as a PhD, and was also in the Department of Family Medicine and Public Health, and has really been kind of productive in publishing peer-reviewed articles, and is playing really a strong role in bridging clinical research, clinical strategy, marketing, and R&D, and strengthening organizational alignment, ensuring that innovations are evidence-based and market relevant, which is, I think, highly relevant for implementation science, because we often talk about the need for intervention and innovation developers to be thinking about implementation from the start. And so think about, scalability, implementability, and, how innovations fit in terms of both kind of outer context policy, inter-organizational context, and how those are bridged in thinking through implementation. So it's, yeah, really kind of wonderful to have you. And I wonder, before we launch into questions, if we could just have you in turn talk a little bit more in detail about your work and what you're doing day to day, and kind of what the larger vision is and how your kind of day-to-day work fits into that larger vision. And so, yeah, we'll go to you first, Amy.
Sure. Thanks, Greg. And good to see all of you that I know and meet those of you that I don't. So I work at a really interesting intersection that I think isn't probably very replicable in many settings, which is that I work for a social impact organization that's an operating philanthropy. That means that all of our funding comes from the Omidyar family, who are the founders of eBay. So that's like kind of the first context of how I work, which is money flows in from a family, but unlike many family foundations where it's a lot of grant making and money out the door. We're an operating foundation, which means that a lot of our work is doing and using those funds to support the work we do, in addition to other work. So one of probably my favorite part of my job, which really is less related to my background, it's something that I've grown into, is Hope Lab is an impact investor, which means that I've gotten to, in the past 3.5 years, learn about the venture capital world and about raising funds. And it also is a place where it comes into, I would say probably the largest part where the implementation science background actually comes in is in the ways that we support our portfolio companies, who are very rarely, but sometimes we have some who are actually themselves come from academic institutions and researchers, but most often they are people who have a passion and an interest and who do not have the background in what it takes to take something and make it scale in an evidence-based and evidence-informed way. And so that's part of what we do there. Also do a lot of youth-engaged research with an eye towards policy, both at this job and my last job. One of the coolest and most exciting parts is I work with policy teams, so folks that are actually doing the connections, which gets me in the room with folks. Like, I think, is it next week? I'm presenting to the National Conference of State Legislators, but it allows me to get research that we conduct in front of these big audiences. And then we also do a lot of work supporting young leaders. And then, as like the other part, the kind of unspoken part of what happens outside of academia when you are at these types of organizations is you spend a decent amount of time managing people and managing teams. And so I have a team of 5 folks that I supervise, manage, and support. And that's kind of my day-to-day area of work. I'll pass it over to Sarah.
Thanks, Amy, and thanks so much for that introduction, Greg. It was great to kind of hear your summary of things. And yeah, I'm really excited to be here. Thank you so much for having me. It's great to see a lot of familiar faces, and yeah, it makes me nostalgic for my days back here in the disc. But yeah, thanks. And Amy, your introduction was fantastic. I hadn't even thought about kind of that level of introduction, but I love that. And I think it's really relevant because there's nice compare and contrast, I guess, with different types of industry positions there. So I've been at Omada Health for almost 4 years now, and it is a very much a commercial organization, right? So we're driven by our customers, our employers, and health plans, and also PBMs, pharmacy benefits managers. So those are kind of our largest customers. And so we're not direct to consumer. We're a behavioral medicine app at the heart of things. We've taken the DPP that was the original impetus for Omada, of translating that into a digital format and providing that at scale to people at risk of developing diabetes. So starting as pre-diabetes company, and at this point we have several products. So we have a still our pre-diabetes product, which is now our weight management product. And then we have a diabetes product and a hypertension product, and then a musculoskeletal product. And so we sell to our large customers, and then through that you have that as a benefit. So if you actually at UCSD, you might have Omada as a benefit if you meet the qualifications. So that's how you would sign up. And so I love that you brought that up, Amy, because it definitely kind of sets the stage for what drives the company. And so a lot of what drives our sales of the company to employers and health plans is actually our research. So that's where that was one of the things that drew me to Omada. Is it's a very much a stands on science. So our slogan used to be Omada starts with science and insists on outcomes. And we still really follow that kind of motto. We really ensure that we have a strong clinical foundation and that we're building evidence-based programs, really taking, we're reading the literature and keeping up with the latest and kind of translating that into our program. And our program itself is a product and app. We also have health coaches who are interacting with you as a participant, as a member, through a digital format. So you're texting with your coach and your care team, a specialist, a clinical specialist as well. And then, getting the traditional kinds of things like you would think of as delivering a behavioral medicine program, a lifestyle program, tracking, self-monitoring, getting setting goals, evaluating those, reading lessons, things like that. And so that's kind of the foundation of the program. And so then the research, where for where my team falls into place is really evaluating to ensure that we are delivering what we, intended to at scale. And so, and then publishing on those results, you alluded to that, Greg. And when I entered Omada about 4 years ago, my team was primarily conducting randomized controlled trials. We were a bit siloed in the organization of kind of just, conducting these rigorous trials, but not really embedded. And so I brought that implementation science angle and kind of transformed the team to be much more integrated into the program. And as you already kind of alluded to, Greg, is really ensuring that when we're designing them and making those updates, we're ensuring that they are, going to be as effective as possible to have those outcomes that we are hoping for at scale, and not just in a pocket of people enrolled in an RCT. And so my team now is really fully embedded and kind of is at the crux of like playing in between the program development process, providing those insights, working closely with other clinical team members who are embedded in our product team to ensure that we're injecting and everything we build is that clinical is at the foundation, and then really partnering very closely with our marketing team to ensure that the evidence we're producing is market relevant, that it's created with the lens of what the market needs, and then with our sales team as well, and how do we translate that into a story that we want to tell to be able to sell more of the program in the market. So we're really kind of working closely with both sides. So my day-to-day is really overseeing my team. I have 4 clinical research scientists on the team who are really doing that, doing the work, and we're kind of working together very closely with both of those sides of the team to generate that evidence and publish papers. So that's kind of what my day-to-day looks like.
So just while we're on this, thank you, Sarah and Amy. But so it sounds like the publishing of papers is important for the image, for the marketing and sales as well. Is that correct?
Yeah, definitely. Big part of our business is that evidence, and that's really what differentiates us from other competitors.
Yeah, because we've seen people in the marketplace around, especially around digital health, and where there's a lot about like the platforms, but when you go into the research, it can sometimes be not as satisfying. Yeah. Okay, so I just want to switch gears and talk a little bit about kind of your transitions from academia. So what inspired each of you to, leave academia to pursue a D&I focused role? And, was there a key turning point or key influence that led to those decisions? And I'll go back to you, Amy.
Yeah. So, I mean, mine was fairly job specific in that I'll actually go back, which is to say it's job specific, but also person specific, which is that I think I found myself in academia as someone who had always thought in like college and applying to grad school that I wanted to work in nonprofit spaces. So I always had that like policy nonprofit angle in the back of my head, but ended up in academia because, it's a great job and the people are great and I love doing it. And then this job came up through, I actually found it on like an NIH listserv in an office that probably no longer exists, the sexual and gender minority office of NIH, where Karen Parker used to sit. And she sent out a message that said that the Trevor Project, an organization that I knew very well from the work, I think Katie Wilking's on this call today, that Katie and I were doing work in New Mexico on LGBTQ suicide prevention, that they wanted to start up a research department. And I thought, well, wouldn't that be a dream job? But I probably don't really have much of a chance at it. And applied and got it. And that was really like one of those dream jobs I couldn't have imagined myself having the opportunity to do. And so it wasn't as much that I had made a decision if I'm leaving academia as a dream job had come into my world that is something that I would have wanted from before I ever got into academia. And it was indeed a dream job. So that's how I ended up there.
Yeah, cool. So I'm thinking, yeah, I can't tell if Katie's on here, but I'm thinking back to the 2012 dynamic adaptation process that we worked on together. And Katie's team just published a paper on the use of that for addressing suicide prevention in schools in New
And it
Mexico.
was
So,
likely
yeah.
that work and doing those types of projects that got me in that job, because there are not that many people, or at least weren't that many people at the time when did I apply for the job in 2018. Probably not that many people doing research in the real world on LGBT suicide prevention. So I think
Yeah.
that project and that grant probably got me the job.
Yeah. And Katie says, could not have done our work without you, Amy. So kudos. So Sarah, your inspiration outside of academia and kind of turning point and your influences that led to your decision.
Yeah, absolutely. Unlike Amy, I had not necessarily envisioned myself doing something else. I thought I was kind of a lifer at UCSD, actually. But what I had always envisioned was really delivering something at scale. I was always having this feeling of like, we're building these programs and next we're going to scale it, right? And so I was kind of a stepping stone. I had, originally started in kind of RCTs and then worked my way to implementation science, fell in love with it, felt like, okay, this is more in line with what I was imagining, and had a grant that I think I presented on actually at this seminar before on exercises medicine using implementation science, and reached kind of the halfway point through that grant. And it was the time when everyone starts asking you, what's your next one going to be? And I just kind of had this feeling of like, okay, I think I found what I'm going to be doing forever. And I think I want to do something bigger that maybe like is not in line with, kind of the traditional funding system. And so just decided at that point I would start looking around to see if there was something else out there, intending to kind of wait until the end of the grant to leave. But I wanted to feel secure and not writing that next one. But ended up finding this position and decided to just go ahead and make the change at that point. So it was really that desire to actually, ironically, to use implementation science to deliver a program at scale, and felt like this was the opportunity to do that.
Then were there particular skills or experiences that kind of helped with that transition? I think, Amy, you described kind of that fit with what you're doing before. How about for you, Sarah?
Yeah, I mean, fortunately, I think that what got me the job was that my former manager at the time who hired me was looking for someone who was very, very steeped in like academic research.
Mm.
And I think that has, that was just a great opportunity. And I think the work that I was doing had always been very much, I was kind of joke that like we were building small omadas and testing them, and that was really what I was doing. So for me, it was like the actual subject matter and the program was very much what I had already been doing. And so I think it was a perfect fit from that perspective.
I'll
Great.
also add, because I think I've also hired a bunch of people outside of academia, and so I have this sort of thing that I've noticed about skills that people have that apply really well, that help people when they can notice them when they're applying for jobs. And I'm gonna focus this specifically on folks who have been a part of like a PI on a grant, but like that means that you have managed a very large budget, that you have managed the resources, the people, the timelines, the staffing, the development of, basically, if you think of the research as a product from start to finish, while collaborating often with other stakeholders across it, and those types of skills, people who are outside of academia, if you just say like I have a grant funded, they don't necessarily understand what that means. And so it's sometimes the translation of a lot of the skills that happen while you're managing a research project into the language that more industry folks understand, which are things like managing people, budgets, timelines, projects from start to completion, and all of that is what happens in a grant. But if you don't explain it that way, the companies aren't always going to notice that.
So thank you. So, I mean, this kind of begs the question of how you take the implementation science and or research principles. How does that get defined? How is that communicated within the organization across different levels for each of you? Are there unique opportunities or constraints around that that affect kind of how you interact in the organization? Over to you, Sarah.
Yeah, it's a great question. I would say the language definitely is the first thing that I notice when you say that. I think that most people in industry, at least in my area, probably don't have a great sense of what implementation science means. And so I think using, different words that they might understand more, like systems change or like thinking about, how to make, an intervention work at scale. I will say that with a caveat that there are actually a lot of positions now opening up in pharma called implementation science specifically or something similar where they are using those terms. But I think in terms of then how to use them, how to like use that skill set and bring it to the organization, I think it's a lot of thinking about how will this help the business? How will this impact? Why would you bring this skill set? What are those outcomes that you're going to see that are relevant? So thinking about, how are you going to save, make things more efficient? How are you going to make things more effective? How are you going to make things a better ROI on an investment? How are you going to ensure that, this makes the kind of difference that people within the company are thinking about? So really thinking about the things that matter to us. I think they do matter to them, but from a different lens. And so really thinking through how do I communicate this in a way that it will resonate with them. And there is a lot of, I think, shift in terms of that type of outcome that would be of interest. So thinking about the business language.
Yeah, I think that's so interesting. And I'm loving like the contrast between your two very different types of organizations. So same questions for you, Amy.
It's interesting because even though they're very different types of organizations, the philosophies are the same, which is part of it is understanding the language that works in the environment that you're in that people use. So like, yeah, I was like the number of times that I've probably this week said systems change, scale, that there's language that's already out there that fits exactly what we're talking about. And so some of it's using it, and some of it for me is sometimes scaffolding, depending where I am, and doing a little bit of education around what this means and why in those types of areas. I would say so in my previous job at the Trevor Project, where I did a lot of supports of teams of things like changing systems and systems change and changing like the suicide prevention rating they were using, and had to deal with things that I used to study and now I was really impacted by, like things like providers resistance to change, and I was like, oh, I'm actually here. And so the more that you can provide, I think, real world of examples of why things happen and ground it in what's actually happening for the people who are there, the more that people will understand. But if I just came in and started using like the lingo from implementation science and started talking about different factors and happening, people would just um, you know, kind of hit that way. But when you talk about the concepts in the language that people understand, I think it's very easy to get people to buy in and understand it. So I would kind of like Sarah double down on the figure out how to communicate with people in the language that works for them.
Thanks. So I'm wondering how this works. So we're talking a lot about within your organizations. And I think both of you alluded to this somewhat in your introductions, but what types of kind of cross-sector collaboration? So academic researchers, community organizers and organizations, payers, policymakers, um, how, what's the landscape of that where you work and how do you navigate that? So just a little more depth on that. Why don't I stay with you, Amy, for this, and then we'll go to Sarah.
For me in my current job, I would say like our audience that I, as a researcher, am most invested in right now is policymakers. Why? Because we're in an organization that's really focused on systems change, and policy is at the heart of systems change. And so that's where a lot of the work in science and science translation happens. We have like translational science grants that we used to have that were like seed grants that our team gave out for exploratory work that are now transitioning into uh, grants to have researchers working directly with policymakers or advocates, sometimes young people who are doing advocacy work. So we work a lot in that translation. And I will tell you a newer area that I'm a little less involved in, but I'm in LA, so I'm more involved in it than I probably normally would be, which is storytelling and narrative change. And so that means we've been working with a lot of folks in like Hollywood. Like I'll be at the Center for Scholars and Storytellers next week. Last week, our team was at an event at the Getty Center, but those are just avenues for research and science translation that I think sometimes, like I think all of you probably have thought about, like, oh, I'd love to see research impact policy. But the other big kind of cultural area that's out there that I know a lot of folks in the nonprofit and philanthropy space are focused on, including us at Hope Lab, is on this area of narrative change and culture shifts through media. So that is an area of collaboration that's a little newer to me. And then also collaborating with other researchers, nonprofits, and philanthropies. But I think the two most interesting ones are probably policymakers and then the folks in what we call storytelling. Which is probably different from you, Sarah. I'm guessing you're probably not doing as much work in storytelling in Hollywood.
No, and I was just thinking, I'm jealous. I want to talk about this more. It sounds really fun.
Well, it sounds so cool, and I've done these trainings over the years where how to talk to the media and how to get your message across, and feel like I never do a very good job. But so this is like really cool and interesting. Sarah, how about the kind of the same questions for you in collaboration across levels, organizations, policy practice, all of that?
Yeah, absolutely. Definitely not as interesting as Amy's, but let's see. So we have had and continue to have some partnerships with academic researchers. So we have had when I came on board, they just wrapped up a study with University of Nebraska, and we've been in the process of an RCT with Stanford Health System, actually with a primary care integration there, which was very relevant again to my experience at UCSD. And then we also have industry partners so Abbott is one of our main partners because we use their CGM as part of our program. And so we've conducted trials with them. Those are really on the research side. And then, given that our customers are, like I mentioned, employers, health plans, PBMs, we do have, a lot of partnerships with them, a lot of interest in conducting, joint research or looking at, custom analyses for their populations, seeing how we can improve. There's a lot of interest from customers in like kind of having their own stake in the game of like, what if you try this? We've done some work with like creating unique messages that coaches can send, based on what is of interest to some of our customers to see if that makes a difference in outcomes. But yeah, a lot of work with specifically, I think lately with health plans and PBMs around GLP-1s, because that's kind of a big, probably, definitely our biggest area of work right now with all of the rage there and working on weight loss. So partnerships with those to see how we can support from a lifestyle perspective.
Very cool. So yeah, you mentioned Abbott, and I don't know much about Abbott other than they sponsor the World Marathon Majors, which I completed in 2023. But yeah, it's like so cool to hear these kind of winding paths and connections, and how you're collaborating. So yeah, I think you've talked about this somewhat, the outcomes that matter most in your organizations. Um, and yeah, I think for the audience here, and just FYI, we have 55 people on the call spanning California, the US. We have somebody from Uganda, just so you know who your audience is, and most of the people in our current D&I course at UCSD, which is awesome. But yeah, so in terms of thinking about those outcomes and balancing kind of scientific rigor with the goals of your organizations, are there any, I don't know if I want to say conflicts, but balancing kind of those issues and how quickly or how nimble you can move to reach the goals of your organizations? Back to you, Amy.
So just in terms of research in general outside of academia, I would say in my experience is like the timelines have to be a whole lot faster. Uh, just the like, and it doesn't mean that there can't be the timelines for, I actually published a lot in my last job, but I did a lot of work that was unpublished that was like getting findings out quickly, whether that was to policymakers, the field. And that's less about like the organizational like metrics per se than it is the idea that outside of academia, I found that people are willing to make changes and do things based on findings that are out there, and that includes like in the press, in self-published, but getting like solid evidence out there with methods quicker. Particularly like when I was at the Trevor Project, we did a lot of work around things that are now going the other direction around like conversion therapy and other things. There wasn't the time, like we did publish on it. We have like a publication that we did in American Journal of Public Health, but that came out like a year or so after that we had amicus briefs showing the data and other places. So I would just say that like in order to make changes in policy in other places, I think it didn't mean that the research had to be any less rigorous. It meant that it had to figure out ways to get into the hands of people faster. That's the biggest difference, I would say.
Yeah, I love that. And, there's actually a implementation science and implementation science communications, kind of our main two journals. There's calls for papers, collection on the pace of implementation. How do we measure it? How do we do it? How do we accelerate it? So very, very timely. Sarah, same kind of question for you.
Yeah, very similar on this one with Amy in terms of the pace, needing to be much quicker and getting things out in other ways. So we still do publish in peer-reviewed journals, but we also have been publishing a ton of white papers. And the primary reason for that is because of the pace, because we wanted, to keep up with like this new, GLP era and be the first kind of out there. And so we've been publishing a series of white papers. We will be publishing peer-reviewed papers to, with the same kind of outcomes in population, but we needed to get that out into market just to be able to kind of keep up. So I think that there's definitely a lot of shift from not only kind of what we find acceptable. It's still, like Amy said, doesn't mean that we're not doing as rigorous of work, in fact. But also thinking about the messaging, and that is what you have, the ability to, in a white paper, the ability to really make it more of a market relevant message that can be less jargony and specific on the methodology, which I think has actually been really fun. I love putting these papers out, actually. It's been a lot of fun to think about how to think about science communication. How do we translate if our goal really is to not only generate evidence for the academic community and learning, but also for getting it out there into the general public? I think it's a great opportunity to really practice that. How do we really reach the audiences that we're trying to actually reach?
I just want to say that I love, and put this in the chat, I love that you're both using the word fun for what you do. And so that begs the question, are you having more fun than you did when you were in academia? And why?
I'm going to say different fun. I will say there are definitely times where I'm having a lot more fun because I'm in a lot of really cool spaces and rooms with people listening to me in, whether it's policy spaces, media spaces, wherever it is. It feels really cool. And I've been able to, do some things that I never expected that I'd be able to do, and to do it in a way that's really fun. I will say the difference is that I think there's a difference between, in academia, you sort of all have the same culture background, even if you're in different disciplines. There's a little bit more of like, this is my people, this is the culture of people that I understand. And so there's a part of that that's really fun. When if something happens that's really exciting and nerdy to me, like I can talk to like a couple other team members, but it may not be org wide. I have to explain to people exactly what this means and why. And so that part it's fine, but that was probably more fun in academia, the parts where you just get it because you all have the same understanding.
Yeah, and you, Sarah?
Yeah, I love that. I totally agree. I would agree with Amy that it's not necessarily more fun, it's different fun. And I also, to just, piggyback on that, agree with, like, I love having my team to nerd out with when we have our team meetings, and we'll go deep. Today we just had this deep methodological question. It was so interesting. But I also love actually communicating with my cross-functional partners, thinking about things in different learning. I mean, always learning about things that I don't know, just about how businesses run and just the things that you absorb. I love that as well. And one thing that maybe I'll add on that wasn't already said is about one thing I do really like that maybe I like better is that in academia you're all together in the same department or in the same university or whatever, but you're kind of all running your own small business within that. And I really love that as an organization, as a company, you're all working toward the same goal. And I think there's like something really unique and fun about that is that you all play different parts in it, but you're all like after the same thing. And the downside to that is that at least if you're like me and you like running your kind of small business, your scope is narrower. And so that actually, that part I think I had more fun in academia in terms of like you kind of get an opportunity to do all the things. Whereas in industry, your role is much more focused on what you do and you're working with others and relying on them to do that part, which can also be great because you don't have to be IT as well as research. But
Thanks. And yeah, I'm encouraging people to put questions in the chat, and we'll monitor that as we go as well. So I'm wondering, what would your advice be for early career researchers or students considering a career outside of academia? Amy, go ahead.
My first advice is, depending on how early you are, stick it out a little longer. Which is just to say that I get a lot of folks who are in the graduate school. I think I want to go into industry. I think I want to do stuff, and I pretty much recommend to all of them to try a postdoc first, just because I think the skills that folks are able to get after graduate school in academia, in postdocs, in those types of positions I've never hired someone from graduate school. I usually want people to have more training under their belt, particularly if they want to sort of move up in the world. There can be a lot of times in these organizations where it's harder, where it's more flat, and so someone comes in and they're like an individual contributor role, and that's kind of where you get stuck until you go somewhere else. And so it's sometimes hard to get that management and leadership experience. And I think that for higher level roles, which is usually what people want because they want to increase their pay, that you usually need some sort of management and leadership experience, and that you can get that in academia. So that would be my first advice, is make sure that you have the skills under your belt before you go that can allow you to move up, because it's sometimes harder to move up in companies. And then my other one is like network with people who are in these places, get to know people, get to know the jobs, and get to know the spaces for when something comes up.
Thanks. Sarah, your take on that?
yeah, I would think it depends on the job that you want. So if you want to be an IC role, an individual contributor role, I think and you know that you don't want to be in academia, I'd say, go for it if you want, like Amy said, if you want to start, being a leader. And I saw a question in the chat around that, and probably important for us to say that not every role is managing people, right? And so there are more roles not managing people, not managing teams, and those are really fun too. I've actually hired all of my roles straight from academia, and they've been fantastic and have been able to transition, right after grad school or in the middle of postdoc. So I think it just depends, like anything. And also, I know we're talking specifically about research today, but there are so many roles that you also would be qualified for that are not in the research space, and those can be interesting to explore as well in industry. So classic answer, it depends.
Yeah, but I think that's like super helpful in thinking about kind of the potential roles, and you can come in depending on the organization, right? You can come in at a certain level and still think about advancement. And I but that sort of begs another question. So in your organizations, what are the resources for people to advance their own careers, like career development, leadership training, other types of supports? Back over to you, Amy.
Oh, in my current job, I was like, we are very well resourced for what people want. You just sort of say you want to do a thing. You can do a thing. I took Venture Capital University at UC Berkeley. My first year, we have learning funds, and you can just say I want to do this next year. And so you could people take graduate classes, people take online classes, people do trainings, people get coaches. I would say at my last job, which is probably more like a traditional nonprofit, we had so there would be like people management trainings, there would be trainings that would be offered and people could sign up to take them, or some of them were mandated. I'm at a differently resourced organization now, which has the benefit of all sorts of professional development opportunities. And both places that I were at were very free with things like conferences and attending conferences and convenings and events, which is also part of the work in those places too. So.
Right. Sarah?
I'd say, it depends on the needs of the business. So there definitely are opportunities at times for advancement depending on what we need. But there has to be, I think that's a difference actually between academia and industry, at least in my experience, is that in academia, you kind of know how you're going to climb the ranks, right? It's kind of, you get reviewed every 2 to 3 years and you have that opportunity to kind of keep moving up. It's not really like that, at least in my space, where you could be doing an amazing job and there's just not a need for a higher level role at that time. And so then you kind of have to, there are other ways you could work on, growing and advancing in terms of your skill set and things like that. But in terms of actually moving up, it might or might not be the right time. And then in that case, like Amy alluded to earlier, there are opportunities. It's not as typical for you to stay at one place as it is in academia. So people move around, every 2, 3, 4 years, depending on, who they are. And you might have opportunities to grow it in another place as well.
Great. Thank you. So I think there's a bit of a more meta question in the chat from Katie. And I think it's relevant both for Sarah, your context, and for Amy's, but can you speak to the pressures that your organizations are under to pick up the slack caused by the disruptions in NIH funding, and how are you guys responding to that? Are there opportunities, or just really kind of what's the lay of the land there?
Yeah, so for philanthropy, there's some organizations that have fairly large budgets. Robert Wood Johnson is the best that I can think of that came in with some just-in-time grants. I will say that there was some convening of folks in the philanthropic space earlier in this year to figure out, like, what do we do? What's most important? Is it most important to fund the final year of studies that got cut off? Is it most important to put money into these different areas? And then it quickly switched from the, like, can we fund these research grants that got dropped? This is just pretty frank here. But it switched to like, oh, is this actually an opportunity to shift the way that research is done and to do things that will fit better with implementation science, but that are getting research into policy and practice, and that is switching the incentives for research so that the outcome of research isn't just peer-reviewed manuscripts, but it's things like relationships with the communities that you are working with, that it is relationships with policymakers. And so I would say that there are some folks in the philanthropy space, Robert Wood Johnson coming to mind is one of the biggest ones, that were immediately like, we're going to put some stopgaps in. And I think there's some others that are like, hey, wait, before we just go picking up the slack on these things, maybe we should figure out if there's a different way forward that isn't just replicating like the NIH model, and that can push forward more into findings that actually implement policy and practice.
Yeah, I think one of the things that we've been advocating, and actually Kara Swanson has been doing work in this area, is this idea of the translational science benefits model. So yeah, there's papers, there's grants, all great and good, right? But what about community impact? What about connecting and collaboration and engagement? So yeah.
That's what folks are interested in and looking for. So.
Yeah. How about your perspective, Sarah?
I would say we haven't really felt that as much in my world. We've received a couple of inquiries from academic researchers looking for partnerships. And I'd say that's kind of the extent of it. And we are very excited and open to that. So if you're interested, please feel free to reach out. We can't always fulfill them, but it is something that we're interested in. But we haven't felt, I think, the level of pressure that maybe some have.
Yeah, so there's a question in the chat about industry and nonprofit, and I think we've touched on this, the importance of research to the mission, where it's not necessarily primary. And so does it impact kind of your roles in the work that you do in the need to kind of make the case for research?
I'm gonna go first on that one, Sarah.
Sure, happy to go first.
Sure.
Yeah, research at Omada, research is considered one of the primary areas. So I think I've been fortunate. Like I said, that was kind of actually one of the draws. But it still is not, as you said, the primary thing. That we're not a research company. And so there is always, always a tension with the second part of your question around, doing the most rigorous research versus moving quickly. And I would say we are, always straddling that. And I feel like we have a good balance. And that is, I think, because one of the things that we're also mindful of, I've talked about the market pressures and the sales, but maybe one thing I haven't yet mentioned is also just the investors as well. And Omada, we went public this year, which was very exciting. We had been a startup for I think 14 years. And so it was a very big milestone. But with that, there's definitely a higher bar to clear to really demonstrate that what you're doing has strong evidence. And so because of that, there is more of an openness, a desire, willingness to ensure that our work stands up, our research stands the test, because investors do look much more closely at those types of things. And also our large customers, sometimes they have in health plans, they have people whose job is really to test these things, and they'll ask, a lot of questions. And so I would say that's, a positive thing for an organization like ours that really needs that in order to succeed. So that kind of going back to like, what's the benefit you bring to the organization, not just what you think is right from a research perspective, but how does that benefit the organization? There is a true need and benefit at that level. So I think it just kind of depends on like what the funding mechanism is, who's paying for it, and what that bar that you need to clear is for research, to ensure that, you find that right balance.
Yeah, thank you. I want to go back a little bit in our discussion. We talked about, peer review publications versus white papers and kind of getting your message out there. Just got me thinking about, does the voice matter? So for example, a white paper coming from Omada or Hope Lab, does that have the same clout as a paper coming from RAND, for example, that has sort of a track record there? That's one question. And then how does kind of relationship building and communicating kind of the right message to the right person or the right organization, how do you think about that, and how do you kind of optimize your messaging and influence strategies? Amy, over to you.
Oh,
Easy
I have
question,
really
right?
great communications teams that do all that work for me. It's been one of the best benefits of being at both the Trevor Project and Hope Lab, is having like entire teams whose job it is to help me figure out the messaging and the influence and where to get things, and that get stuff that into, CNN. I don't do any of that work. I just show up for interviews and I do the research and I show up. And they get me talking points. And sometimes, I mean, at the Trevor Project, I have like op-eds and blogs. They're ghostwritten. I go through and I edit them afterwards. And that's like a massive benefit of being at one of these organizations, which is that I have folks who are really good at messaging, and all I have to do is make sure that the research remains accurate and in my voice and the way that I want it to be. And so that alone is something I would say is one of the biggest benefits from the ability to translate research that I've had outside of academia, and one thing that I wish academia had more of, which is the people who are in marketing and comms who can figure all of that out. To the second part about the white papers, I haven't found any, and we do a lot of ours in collaboration. So we've done them with like Common Sense Media, who has a lot of, I just had meetings with Rand last week who want to do a report with us on something. And so I actually think that in the space that like, yes, like do I personally think of Rand differently than like some other places? Yes. Just because of the work that they do, but we do a lot of work with like Pew and Rand and other places. And I would say that like it depends on who you're talking about. If you're talking about academic researchers, probably. If you're talking about policymakers, CNN, other places, no, they just really care that it's from a reputable group, of which I think that we are both at, and most people who are doing this work is. And so but it's the comms team, it's not me. I'm not doing anything special.
Right. That I completely agree that I know, like, personally, I could definitely benefit from a communications team. And I think it speaks back to that discussion we were just having about, the products from academia versus impact and communicating that impact. So Sarah, your experience with that?
Yeah, definitely. We have a great communications PR team as well. Our marketing team really helps us to translate. I was just telling I work very closely with our head of marketing, and last week I was showing him some results, and immediately, he was like, said them in a different way that just sounded, so much more relatable. And I was like, I wish that was how my brain works. So it's just a great yin and yang to like be able to, and he and I like feel like we've kind of both met in the middle, where he's always like, I'm always thinking, what would Sarah say? And I'm always like, well, what would Rob say? So I think that there's a great, um, blend there, but I for sure rely on so many others to have that communication. And I to your question about the level of, I guess, authority, I would absolutely say Rand, or something like that would have more of an authority than an Amada white paper. But we do have our chief privacy officer. She came very big name that used to work on Capitol Hill, and very, very, very well connected. So that's kind of our biggest connection with policy. And she's definitely has a lot of, I think, clout and authority there to be able to kind of influence decisions, and is kind of checking in, with our evidence and providing that to policymakers. But we're not definitely a policy organization like Amy is describing.
Yeah, I mean, we're kind of approaching the top of the hour. This has been so helpful in kind of thinking about these other issues. And I think, the issues are beyond just thinking about, making a switch or working outside of academia, but there are a lot of important lessons for academia about how we can have impact instead of kind of having that pretty myopic focus. I'm going to ask Kira to put the evaluation link in the chat while we oh, there it is. Perfect. Encourage you all to take a couple minutes to do that. Actually, it's only a minute or so. But yeah, any kind of final thoughts about these issues, Sarah or Amy?
I'll just double down on what you just said, Greg, which is that I think academia is great. I've been super lucky. I've actually loved all of the jobs that I've ever had. But I do think that there are things that each of them can take, and academia is certainly one that feels the most different from all that. I work a lot with folks in industry and mental health tech startups and nonprofits and philanthropies, and I would say academia is the most unique on its all academia has a lot in common with itself, but not as much in common with the other places. And I think that there are some things, particularly in the marketing and comm space, that would be really cool to see things get out better, because I will say that there is a real appetite. The question about like, do I ever have to sell research? I don't, because the organizations, people are really excited about research more than I expected. That was a big fear of mine leaving academia, was that people were not going to respect. People respect research so much. You just have to give it to them in ways that they're able to understand it. But I've been shocked at how much all across all these levels people really respect and want research. And so it's just like a question of how can we get it to people the way they need it.
Well, that is highly refreshing to hear. Sarah, final thoughts?
Yeah, I love it. I totally agree with what Amy said. I would just say maybe my final thought is if you're thinking about it and you have a desire to see what else is out there, you know, explore it, make that leap, maybe even reach out, make some contacts, even if you start with like um, asking if you want, if an industry group wants to partner on a paper or just get some exposure, test it out. I think it definitely is very different, and so many of your skills are translatable. But it definitely requires a shift in mindset, being adaptable, thinking outside the box a bit. And I think that it's a great space for more researchers to get involved in. So I encourage you to do that if you're interested.
Great. Well, thank you so much. And this makes me just want to connect more frequently than every few years. So maybe we'll try to think about ways to do that. Thank you again for sharing your kind of expertise and experiences. I think it's super helpful for our participants here.
Thanks for having us. And if folks have follow-up questions, it's fine to share my contact information. I'm happy to chat with anyone or answer anything.
Okay, great.
Same.
All right. Take care, everybody, and do the little one question survey. Thanks a lot.
Have a good one. Good seeing
Okay.
you. Bye.
Bye.